and I will gladly pass it over to our first speaker, invite Dr. John Cafardi. John is a assistant professor of medicine at the University of Cincinnati and is at the Christ Hospital. We welcome John, and John, I'll pass it over to you. Thanks so much.
Oh, good afternoon, all. And thank you so much for allowing me to participate in this today. Excuse me, I'll pull up my slides here today. I assume these are correctly shared.
Looks great. Thanks, John.
Looks great. Thank you so much. So today I wanted to speak on a study that we have done in our linkage to care and postpartum treatment. These are my financial disclosures. I've served on advisory board for Gilead Sciences and received grant support from Gilead, Merck, AbbVie, and CTI Biopharma. Some background here. As we are all aware, unfortunately, postpartum linkage to care of both HCV-infected mothers and testing of infants at risk has historically been quite poor. One of the seminal studies on this was done from Philadelphia, and they looked at the population from January of 2011 to February of 2015. There were 537 children born to 500 HCV-positive women. Of these, 84 had HCV testing performed, with 4 HCV-infected children identified. That comes out to 16% of the children were tested, and 1% of them were identified. Based on estimated vertical transmission rate from the literature, an additional 23 infected children were present but not identified. In Boston, from January 2014 to March 2018, the baseline linkage to care was roughly 17%. This is with linkage intervention. With linkage intervention, this increased to roughly 24%, while linkage intervention plus co-localization of care increased this to 52%. Integration of prenatal and HCV care is reported to increase linkage, identified in 1 academic centers. However, only 12% were treated, 2 through a clinical trial and 1 via postpartum treatment. Now, why would so as I include all this, we are seeing that linkage to care, treatment, and testing are 3 very significant obstacles. And though we have these wonderful therapeutic agents, they are not getting to the people who need them. So what we proposed was this study. We did actually work on trying to come up with a good acronym, but that was abandoned. So I applaud Catherine for STORK. I think that was pretty clever. I wish I'd come up with something like this. This is an investigator-initiated study that was funded by Gilead Sciences and sponsored here by the Christ Hospital. It was run from June 2018 through June 2022. And pregnant women who were identified at or before 36 weeks gestation and were followed 12 months postpartum. Maternal treatment with sofosbuvir velpatasvir, Epclusa, was initiated 6 months postpartum, and assessment of SVR12 was performed 12 months post-delivery. Importantly, subjects were required to cease breastfeeding before initiation of treatment, so they could breastfeed for 6 months afterwards, after pregnancy, but had to stop at that point because we did not have clearance for the drug to be used in breastfeeding. This was included in our informed consent and discussion with women prior to study enrollment. Maternal viral samples were obtained for archive at 36 weeks and infant samples at 12, 24, and 48 weeks post-delivery. And vertical transmission pairs, the purpose of this was to have any vertically transmitted pairs to undergo phylogenetic analysis. So results, we had planned an enrollment of 150 subjects, but this was cut back due to the COVID-19 pandemic. We wound up enrolling 54 subjects. Evaluable data was obtained on 49 mothers and 27 infants, and there was 1 confirmed vertical transmission. Of these evaluable individuals, 19 achieved a documented SVR12, and an additional 7 reported completing DAA therapy. By this, we mean they returned to clinic for new medications, they returned used bottles, pill counts were conducted and found that they were accurate. However, they did not return for an SVR12 visit. 1 withdrew after study enrollment, stating she did not want to stop breastfeeding and begin DAA therapy, which, as mentioned, was a condition of study participation. 26 were lost to follow-up and did not complete therapy throughout the study. Of these 26, 2 reintegrated to care at our institution following the closure of the study and are in the process of receiving DAA therapy. There was 1 additional patient documented who completed treatment at another institution. All of these individuals that we were able to follow up with reported difficulties with care coordination that they attributed to COVID-19 associated social challenges. So in summary, 35% were linked to care and achieved an SVR. 48% were successfully linked to care and completed treatment. 55% of the infants were tested with a 4% vertical transmission rate. The maternal viral load, in this case, the maternal viral load prior to delivery was 2.1 million with a genotype 3, and phylogenetic analysis of this transmitted virus sample is ongoing. And determination of remaining subject outcomes is in process. I guess we should say attempted determination, because a lot of these were very rural and we've been trying to follow up with them for years, but at this point, we're still continuing to attempt to reach out. So our linkage with care was consistent with observed historical trends involving linkage interventions and co-localization initiatives, 50 to 60%. Our rates of successful treatment were markedly higher than in prior reports, although the provision of medication as part of the study makes extrapolation of this finding difficult, given third-party trends with given current trends with third-party payers. And I also will add to this that our test rates for infants were significantly higher than has been reported in the past. We believe that this is a result of both co-localization and making this co-localization of care and making it part of maternal treatment, that we don't separate out mother and infant, that these, as they came in for their study visits and their follow-up testing, mom was also getting treatment. We believe that was a key point to take away from this. That is all I have on these, and I look forward to presenting more on this as we have our phylogenetic analysis completed and hopefully some more data that is provided. Thank you.